1 in every 8 women will be diagnosed with breast cancer at some point in their lifetime. It's a family of cancer, breast cancer is, and not a single disease. Dr. Shahla Masood, you can come on out now. We're just getting her mic'd up here. Dr. Shahla Masood with UF Health is here to tell us about a free event to learn more about breast health. Come on down, like they say on Price is Right. Good morning.
Good morning, everyone.
You've made this not just your career, Dr. Masood, but breast health and pathology really has been your life's work.
Absolutely.
Because as long as I've been here, which has been for many years, you have hosted a public forum for women, a free forum for women and men to learn more about breast health. What is it about it that's caused it to be your mission?
I think one of the most important components is the sort of a personal experiences. Having a very close friend of mine developing breast cancer at early age and taking care of the children and knowing the impact of breast cancer on the entire life of a family. Many years ago gave me that indication that I need to know better and I need to do more. And in that scenario, I also recognize that there is so many alternatives now available in managing and detecting breast cancer that breast cancer is no longer a disease that can be handled by one physician. Mm-hmm. So we need a multidisciplinary team of physicians and experts to take care of a woman as a whole. And that has given me the indication to really work very hard, practically across the globe, to first of all, bring the breast health education as a very important component of both physicians as well as the public, and also established the concept of breast health center. Mm-hmm. I initiated the first regional University of Florida breast health center in the region. And really, we have brought unbelievable experts and authorities in different areas of breast care to work together.
Because like you said,
to take care of a patient.
It can't be managed by one doctor alone.
Yes.
Now, when you say that it is a family of diseases, I think that surprises a lot of people. It certainly did me. What do you mean by that?
Because breast cancer is not a single disease, and it manifests differently, presents differently, and is biologically different from one another. Mm. Therefore, they require a different, first of all, recognition of the biology and extent of the disease. And the second thing is looking at the options that are available for breast cancer. There are right now low-grade cancers that they may not require really cancer therapy, and a very extensive surveillance and follow-up is going to be sufficient for them. Mm-hmm. So public need to know when they develop breast cancer, don't panic. Go to the physicians and better understand what you have, and then decide and choose wisely what is it that is best for you.
We have 30 seconds left. I want to talk about this public forum that's coming up in October, and you've got a host of doctors here. What do you hope people will learn from them?
What we are hoping to be people to learn from this is to be able to recognize the early signs of breast cancer, to understand that breast cancer is not really a fatal disease if it is detected early and managed properly. Breast cancer is really a chronic disease, and in a small number of patients with very aggressive form of breast cancer, that is concerning. The rest of them, detected early, refer to the physicians early, have a self-awareness of breast. If there are changes, refer to the physicians, and then come to our public forum and ask whatever questions that you have from there.
Ask a lot of questions. There's going to be about a dozen physicians available to you for free. And dinner is served because Dr. Masood is a generous host, a gracious host. What everyone should know about breast health is Thursday, October 3rd from 5:30 to 9 at the Omni Jackson Hotel. But you have to RSVP by September 28th. And you just need to call this number 244-6069 to RSVP. Thank you, Dr. Masood.
Thank you.
Nice to have you here.
Thank you.